rural South Asia, and we are going to have a Google Hangout session on geriatric issues. Today it's focus on cognitive health, and today we have a senior journalist, Patrulekha Chatterjee, who has done some remarkable work on health issues and published various papers in leading medical journals like Lancet, and also done various reports for WHO, UNDP, and UNICEF. Now it's over to Patrulekha. Thank you.
Hello, Pratyush, and hello, Dr. Rupesh Jha, who's joining us from UK, Birmingham. I think Birmingham, is that correct?
That's right.
Dr. Rupesh, can you hear me? Yeah.
Yes, it is from Birmingham.
Right. So I'm very, very pleased to moderate this second Google Hangout. And I think today's topic is very, very important. It's on cognitive health and how it affects the elderly population, older adults. Um, Cognitive health, for those who may not are familiar with this term, is simply the ability to clearly think, learn, and remember. And it's a very, very important component of the brain health. I think it also includes a whole range of other things like motor functions, emotional functions, sensory functions, etc. And I think as a layperson, um, one of the fears that all of us have about growing older is not just the physical inability to do physical things, but also the brain, the decline in cognitive health. And so I'll on that note, I think I'm very, very glad that we have a new person.
Yeah.
Hello, Dr. Osden.
Hello, how are you?
Fine, great. You're from Turkey, right?
Yes, I'm from Turkey. Turkey, Izmir.
Okay, great. So that's fantastic. So we already have three countries now: India, the United Kingdom, and Turkey. Slightly different, time zones. And I'm very, very glad that we're discussing this extremely important issue, which is in the mind of all elderly people, and even those who are not yet 60 like me. This one of the first things I think about. Oh my God, what's going to happen if I actually cannot if my brain stops functioning, or if I have a memory loss, or if you have dementia. It's kind of, there's a lot of fear, a lot of myths around it. But you people are the practitioners. I'm a journalist. I'm going to ask you some questions. And so who wants to go first? Who wants to tell me what is it like in their country, in addressing this problem? It's a major factor in ensuring the quality of life in older adults and preserving their independence. So who wants to go first in describing the broad situation?
But I don't mind. I don't mind.
Yeah, sure. Go ahead, Dr. Jha. Dr. Jha from the UK.
So I'm a family physician. I've been practicing here for the last 15 years, and I was at the the conference we had in April, and dementia, as you rightly say. So our criteria, anything above 65, we called as elderly, aging population above 65, and as you rightly say, that this problem is not just in countries like India. Even we have problems that the population is aging, and because the way the health economics varies a lot, we find people are living longer, which means they need more resources to look after them. So although we may be thrilled to find illnesses and find treatments for lots of illnesses which we couldn't do earlier, now because we have been able to treat a lot of medical conditions, people are living longer. It is becoming more a huge burden. Not just well, I'm talking from a UK perspective. It is from a general practitioner like me. We are finding this is a big challenge, and which again comes down to resources, their care in the community, and I think that it's all linked.
And I mean, in other countries, in developing countries, emerging economies like India, for instance, we always look upon the NHS as this big model, right? The treatment is free. You have universal health care. People don't have to worry about the cost of seeking healthcare, which is a big issue in my country, India. How does it? You mentioned its challenges. So as a family physician, what do what kind of challenges, I mean, say the top challenge that you are seeing at the moment in Birmingham, where you are based?
So So one of the biggest challenges patient care. So as people get older, as we can understand, so the common issues with dementia is not just aging and the actual illness. So the illness can range from a senile illness or senile dementia to have Alzheimer's or any organic illnesses leading to dementia. But the main issue is the care. And because the care becomes an issue, how do we look after a patient in aging population where they need not just their um, needs to be looked at. So the biggest challenge we find in terms of care is in terms of physicians is their actual physical care, physical and mental care. Who looks after them because they get
Of
to a
people who
situation
have
where
been
they can't look
diagnosed,
after.
right? I'm sorry,
Yes,
the physical care of people who have been diagnosed with Alzheimer's or dementia. Is that what you mean?
yes, yes. That's one.
Right.
Two, there is still the prevalence as such. So the prevalence in UK for dementia,
Yeah.
you would expect the prevalence to be high, but unfortunately, the numbers are still low, and there are still quite a few people who have not been formally diagnosed with dementia. Now,
Right.
these are patients who have, although we have a screening process, we screen patients for dementia, especially have the, if they, in particular, if they have a chronic illness, especially
Right.
diabetes and hypertension and risk factors. Then
Right.
there is the issue is the prevalence. We still have lots of patients who have not been diagnosed. So it's not just patients who have been diagnosed. The issue is also
Mhm.
to increase the prevalence.
Right, right. And they are not diagnosed because they did not seek, they did not realize, like, I guess, I mean, I don't know, I'm not a dementia expert, of course, but is it because they ignored the early alerts and they let
Yeah.
things
So
slide?
so yeah. So a lot of time people take this as normal. So the difference being from being, oh, I'm getting old, to, oh, I have a chronic illness. Difference is there.
I'm sorry? Have you lost him or?
I think his video is lost somewhere. So we can
Okay.
discuss with Turk.
Can
Yeah.
you see
Yeah.
having a chest pain? It is very difficult. Views aren't.
Okay.
Can hello?
Yeah, 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 we can hear you. So you said that,
Yeah.
it's people don't, they see it as normal. Dementia is part of it is memory loss, right? Memory loss,
Yes.
right? So is
So
it you're saying that a lot of people, including in developed countries in like UK, where everybody's educated, at least the basic education, is that what you're saying? That when they start getting the initial symptoms of, let's say, memory loss, they some of them tend to pass it off as, oh, this is old age, it is normal. Is that what you're saying?
yeah. So the common scenario which I will have would be very rarely patients would come to see me. Oh, I think I've got a memory issue. I normally get a
Right,
carer, a family, or a friend saying, I
right,
think mom is having issues with her memory. I'm having problems with my mom. So that would be a common presentation.
right.
They would come to see us. Yeah.
Yeah, so it's like in all diseases, I think it's the early diagnosis, if I understand you correctly. The early diagnosis is absolutely key. And then now I want to turn to Turkey. Doctor, please correct me if I've got your name, pronouncing your name correctly. Dr. Ozden Gokdemir.
Yeah, my name is Özlem. Yes.
Ozden Gokdemir, right? Yeah.
Yes, I'm a doctor family physician, and also I've got some my PhD about physiology, and I'm working in a university in Izmir University of Economics Medical Faculty, and in our next term, in this term, with our second year medical students, we will just make a project about elderly houses. We will visit their houses. And by this way, our students will also see those elderly people that we will look after them in the near future when they graduate from the faculty. And also they will just see what will they do with those people, because in Turkey the things are changing so immediately, like most of the developed countries. We are changing too. uh, Last decades, our elderlies were living with us, mother, grandmother, and
Nuclear family.
living all together in a big family. But
Right.
nowadays, we are just making urbanization, and maybe because of this region and
Yeah.
reason, our elderlies are becoming to live alone sometimes.
Hmm.
As family physician, we should take another perspective for these elderly people too.
Right. And in Turkey, is this something like the cognitive decline, which leads to a whole range of problems, mental memory loss, Alzheimer's in sort of in extreme cases, maybe even loss of motor functions, lots of these things. Are these topics which are in the health fraternity? Is it something which is really discussed, or is it something which is not yet uh, discussed with so much importance? And what is it like, right now? Let's say, if you're an elderly person, uh, to what extent are you likely to get the care that you need in this respect?
As an individual, it will just have a real wide range. What do I mean? For example, I am living in Izmir, and Nazilli is so near, close to Izmir. It's a near city of Izmir, and
Yeah.
in Nazilli, there are people are living much more than 70 years or 80
Right.
years. So there are lots of
Right.
elderly people, and that also means that there are also lots of people about who has got diagnosed dementia too, Alzheimer or the other vascular demence. And because of those reasons, in big cities like Izmir, Ankara, Istanbul, there are lots of places as nurseries too. People just can go there when they are being elderly and could be looked after. And this is something new. But in Izmir, it was an old story. It wasn't a new thing. But for the other cities, it's just going forward, so you
Right.
can get care about yourself.
I want to ask a very basic question, for, let's say, somebody who has not yet hit that geriatric spot, but who worries nevertheless, like a lot of other people. Is there any specific age at which you're really at risk of dementia or Alzheimer's, or decline of cognitive health? And more importantly, what preventive measures? Of course, aging is a normal process and aging is natural, that everybody accepts. But even accepting that, are there kind of things which are contributory factors and which hasten the decline in cognitive health, and the corollary, that what preventive measures can we take to reduce the probability of the early onset, of the decline of cognitive health?
Well, it is not only a problem, it is the society problem, I think. Because, as I said before, in Turkey, our grands were living with us, so we do know what's happening to them. And so we were just looking after them because it's just stuck in the family. But now this could be just get help from the government or societies or the nursery houses.
Right.
As you mentioned before, when it's just come to the declining, it's everybody's problem.
Yeah, I understand. Maybe Pratyush or Dr. Rupesh Shah, you can come in on this. Medically, are there things? I mean, you've seen people who suffer, but medically, like, let's say somebody doesn't have these problems as yet, but is aging. Are there things which can help or arrest or reduce the probability of the early onset of a drastic decline in cognitive health? Because it seems to me cognitive health is absolutely central to the how we age, right? I mean, we have seen people who are 70 and 80 and 90 and absolutely fine, in terms of mentally, and there are people who have undergone these things. So what are really the factors, if I may ask, which contribute or worsen, the likelihood of, to hasten the likelihood of an early onset? Pratyush, do you want to go in that? Yeah.
Yeah, before we start, just I want to give a brief about how the things are going in India, because we have around 4.1 million people suffering from dementia in India. It's a huge number, and we expect these numbers to increase. Just 100% there is increase. It will double by 2035, which is huge. And if we look at global scenario, we are the second most number of individuals suffering from dementia. So the problem which we have is issues, and about the geriatric population which we have, which we're discussing. According to the last census in 2011, we have got 104 million population in India, and by 2026 we expect it to rise by 173 million. So
Hmm.
approximately 20% of our population will be population above age of 60 will be by 2050 we'll have around 20% of population, geriatric population will be there.
Right.
We expect more and more prevalence of dementia among geriatric population. Now coming to the you point that how we can hasten it. Obviously, we have got the pharmacological treatment for that. But apart
Right.
from that, for there is also non-pharmacological treatment, means without medication, how we can help them. So for
Yeah.
that, that is most important for the people to understand to have a healthy lifestyle, because everything what we do, what we eat, and where we live have got some other effects on the dementia and the cognitive health.
Right.
A healthier lifestyle, those who are living in the polluted area than those who are living in rural areas, the cognitive decline may vary. Even the
Right.
research done in the different parts of India shows the prevalence of 3.34% to 0.8%. There is significant variation across different parts of the region. So
Correct.
there are other influential factors. There environmental factors are also there,
Yeah.
which also contribute to our geriatric dementia prevalence. So we need to look after these non-pharmacological interventions like taking a healthy diet, whether our diet contains all the necessary ingredients, whether our lifestyle, how is our lifestyle, whether we follow a healthy lifestyle or not. Then about the non-communicable diseases, which is rising every year, like diabetes and hypertension, and how we can avoid uh, increasing prevalence of NCDs. So these things are most important.
Right.
And obviously, pharmacological treatment at the end is there for everyone to take the benefit of. But before that, we should rely on healthy lifestyle and diets. These things are important. Thank you.
That's interesting. So, if I understood you correctly, you're basically saying that yes, it can happen. Are you saying that it can happen to anyone? Maybe it's part of the DNA, or but it's not inevitable, because as we know, I mean, we all know people who are elderly, but not everybody's suffering from dementia, even if they're
Right.
80 or 90, right? And not everybody's got Alzheimer's. But what you mentioned, that statistic is actually quite frightening. I think you said 4 point something million. 4
Yeah.
million, is it? Four
We have
million.
got, yeah, we
Yeah.
have got, yeah.
Yeah, around 4 million or something people are suffering from dementia. I mean, that's an extreme condition, and it's not just what it means for caregivers. That, of course, is a very serious issue, but also for the individuals themselves who are suffering, because it's really like you're not able to lead a life, a kind of a real life, right? If you're suffering from dementia. And you mentioned that things like diet and also environmental factors, which can make things worse. I suppose environmental factors like polluted air, and that's really frightening, because like the city where I am right now, Delhi, its figures are right on top of the polluted city list. So sometimes I'm wondering whether it's not just when we are young, but is it going to make things more risky for us, in terms of cognitive health, as we age, if we happen to live in polluted cities, and breathe polluted air, because everybody says go and exercise, but if you exercise, if you go out for walks or runs in polluted atmosphere, things may get worse. Yeah. So, Dr. Azim, good to have you back again. And Dr. Cha, I was asking you, so right now, can you tell us, I mean, what is the situation, for instance, in Alzheimer's in the UK, and what is the kind of things you advise people if you see the early onset of Alzheimer's? Like, what are some of the practical things they can do to 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 so that it's arrested? I don't know whether it can be cured. Probably not. But can it be cured? Can
No,
you get cured if
no,
you have Alzheimer's?
no.
No. So, okay, so
No.
maybe you can arrest a further decline. Can you
Yes.
do that?
Yes.
Yeah.
Correct.
And what are
And
some of the practical things that people can do to make sure that things don't get worse once you are diagnosed with, let's say, the early stages of Alzheimer's?
so that's very interesting because the the current treatment which we have, and there are only a couple of treatments available. The rivastig means. So the issue what we have is these medications are not meant to cure. They delay the progression of the disease. I think that's where the issue is. That
Right.
these medications which are currently available for treatment of Alzheimer's, they don't
Yeah.
cure, but they reduce the progression. So something that would have naturally gone from moderate to severe in say 5 years, it would make it to 7 years, or
Right.
maybe slightly longer. Now,
Right.
so the current medications are not curative. It probably helps to reduces the burden, reduces the illness, and slows the progression. We have quite a few patients. We are monitoring and we're looking after patients, and we review them. Now, as far as your question goes as to what you can reduce or what you can do to stop it, or reduce the
Non-pharmacological,
impact.
non-clinical, yeah,
Yeah,
not medical.
yeah. So what is also important to understand is that this is like an organic or a pathological cause for dementia, but there are other illnesses, as Dr. Pratyush very rightly said about the non. Sorry. Hello, can you hear me?
Yeah.
Can
Yeah,
you
yeah,
hear me?
yeah. Please continue.
Yeah.
Yeah. Yeah, yeah.
So
You were onto the non-clinical, the non-medical
yeah.
reasons. Yeah.
So most of these. So sometimes there, as I said, there are different types of dementia, and you always have Alzheimer's, and then patients, if they have risk factors, say hypertension, if they have
Mhm.
diabetes, or if they have high cholesterol, if they've had it. So all these will be a risk factor for other types of dementia, which is a vascular dementia. So as Dr.
Uh-huh.
Pratyush said, that if we maintain a healthy lifestyle so that we reduce the
Right.
burden other illnesses, because one, you cannot stop Alzheimer's from developing if you are
Right.
if you are kind of, if there is a family history, and if there is a strong genetic link, then you can't
Yeah.
stop the things. But what you can do is that if you can stop other forms of associated dementia to running
Mm.
along with Alzheimer's. So patients with an Alzheimer with a very severe hypertension or with vascular illnesses, diabetes, coronary artery
Right.
disease, they will tend to progress more faster and quicker compared to someone who is
Okay.
otherwise well. So I think it's important. The
Mm.
healthy lifestyle, as is mentioned, is very important.
That's really important because I mean, so these usual lifestyle diseases that we talk about, and in India, for instance, we are seeing. I mean, I think for the first time, non-communicable diseases are now more than the communicable diseases. Isn't that correct, Pratyush?
Look, the thing was that earlier the communicable disease was the main focus, but gradually,
Right.
as and when the lifestyle is changing, we are seeing more and more cases of non-communicable diseases. Like in every 10 people, one is suffering from diabetes. Similarly goes for
Right.
hypertensions and everything. So we are
Yeah.
seeing much more and more cases of these NCDs, and that's the cause of so many diseases like
Right.
dementia. Like those who have got diabetes and hypertension, they are at much more risk to develop dementia.
Hmm.
Look, because these are the risk factors. Apart from those, the advancing age is obviously one of the risk factors, but apart from that, like illiteracy, addiction, hypertension, diabetes, poor socioeconomic status, trauma, familial and genetic factors, which you talked about, that whether can we get early dementia or not. So there are
Yeah.
some genetic roles are also genetic factors also, which may also determine to have earlier dementia. Apart from that, there's
Right.
nutritional factors also important in that.
Nutrition. Did you say nutrition?
Yeah, nutrition is also very
Yeah.
important. That
What is the kind of, we heard the term, I think all of you have used the term expression healthy lifestyle, and how healthy lifestyle is extremely important to prevent or to arrest the progression of the decline in cognitive health. Now, if we can unpack this term healthy lifestyle, I mean, what are some of the practical things that people can do? Let's say somebody who's approaching 60 and right now is healthy, there's no problem, but what are some of the practical things that he or she can do to make sure that it doesn't, they are less at risk of getting these conditions?
the most important thing is to have a they should have a very good diet plans which should contain all the essential nutrients. They should properly divide between the diet contains a proper amount of carbohydrates, proteins, fats, and also the essential nutrients like vitamins is sufficient or not, because vitamin
Right.
B12 have also been linked with neuropathy and may lead to some dementia also. So we should have
Right.
proper, the diet is important. Apart from that, exercise is very important for geriatric population also. They need to
Yeah.
socialize more, because these cognitive health may also have some behavioral aspects also. There is some
Right.
behavioral changes also. S- if the patient is depressed or have anxiety, they may also have some symptoms of dementia. So we also need to
Uh-huh.
make sure that the patient is socializing well. He's also meeting his
Right.
friends, he's also going out for a walk. Okay, so these things are also
Community
important.
support and things like that.
Yeah, familial support, these things are also important. Exercise, diet, uh,
Yeah.
social support and family support is all plays a bigger role in overall health profile of a person.
Yeah, and that's very important. And I think what I'm getting from all of you is that though you're in different countries, though we are in different countries, there are certain definitely common kind of threads running through all what you said. And I want to get in Dr. Osden over here again. Dr. Osden, are you there? Dr. Osden?
Mm.
Is Dr. Osden there?
See, yeah, I think
Oh,
muted your mic. We can discuss.
yeah. Is Dr. Osden there now?
No.
Okay. So yeah, okay, fine. When she comes in, I wanted to also talk about the gender aspect, because you mentioned that exercise, diet. Now, say from an Indian perspective, I know that women, women usually as they grow older, we've seen they are more sedentary than men in many cases, especially in the urban context. Right now, we're not talking about agricultural laborers and things. Now, how does that, are you seeing, whether it's in India or whether it's in the UK, are you seeing any specific situations, specific conditions of women patients, who are going through cognitive decline? I mean, is there, are women more vulnerable, and if so, why?
Um,
Who are you asking?
Dr. Austin, are you back?
Yes, I am.
Yeah, okay, yeah. So I was actually talking about, the sort of gender differentials, if there are any there, because we talked about how families are no longer some common situations, right? Like it's no longer the extended family, and the not have to worry about caregivers. People are living in joint families. People have busier lives. So the elderly, I mean, even in rich countries, we're hearing, as we're hearing from Dr. Rupesh Shah, that caregivers, organizing caregivers, a good quality of care, these are all issues. I was just mentioning that we talked about how we can reduce or prevent the early onset of a decline in cognitive health, and this was mentioned that exercise, healthy lifestyle, nutrition, these are very important. In India, we have seen that women, for instance, and I'm talking more in the urban context, are they take less exercise quite often. And is there a gender, are you seeing any special conditions attached to women who are elderly women who are showing a decline in cognitive health? Are there any special features?
Well, if we are talking about in Turkey, as I said before, we are a big country, not only about the amount, but also crowded country. And
Right.
and again, if you look at the researchers, we can just say that, for example, leg exercise. Most of the leg exercise just affect the prevent decline of mental health. What do I mean for the cognitive health? If you do make exercise before being elderly or within you are living with in these aged years, that means you can protect your brain. If you just talk about the part of the brain, for example, frontal cortex, well, I'm sorry, the last resort says that frontal cortex is so stacked and just protects its condition. But if you talk about amygdala or hypothalamus, we can just say that exercise or antidepressant drugs, let me say SSRIs, just could affect these places. But what could we do to prevent these non-communicable diseases that we could face? As our colleagues just talked about before, lifestyle is the main key. But could we just do it at all the time? I mean, in Yemen, you may say, in Afghanistan and so on, there's war there, and people are just fighting. And the question is living or dying, and we are talking about lifestyle medicine. So first of all, I have got the right to be alive, and afterwards I can talk about the quality of life. So it is the same if we are talking about gender. If the gender as a woman, if people are let us live, so there's no problem. Women can live longer. Maybe because of estrogen and whatever. If there's no war, if there's no domestic violence, if everything is okay, so we are living and we are living in a quality life, a very qualified life, and also. But if we couldn't see these things like the risk of life, so lifestyle medicine could be
So you're saying that women are not particularly or more at risk of dementia or Alzheimer's. Is that what you're saying? Hello? Hello?
Yep. I think there's some network issues are there.
Yeah, okay, no, so I just wanted to understand this issue about, whether women, say in India or the UK, from what you have seen, are women at any special, are they particularly at risk, or they are the same risk as men?
Look, if you look after some research reports online, uh, th- there are some conflicting reports are there. Like some reports have shown, some research reports have shown that the gender, the female gender has got increased risk of having developing dementia. But some reports have shown that the risk is similar for both sexes. But most of them
Right,
have shown that there is increased risk for the women population. But there's no any clear cut
okay,
findings which shows that women are at much more higher risk. If risk
right.
is there, it's not very high, is the
So medical science is there are this contested terrain. Medical science is not yet kind of there's not absolute consensus on whether women are particularly at risk or not. Or let's say they are at equal risk, since we don't know
yeah,
what the situations. But Dr. Osden, I think mentioned a very interesting point about I think she brought up Afghanistan, Yemen, and what is, I mean, we don't really think of it that way. When we think of conflict zones or war zones or situation, we only think of the actual death and life, right? I mean, whether people are dead or not. We at the most we talk about mental health, maybe depression, but we don't really factor in how that situation can impact the elderly population, especially their cognitive health. I think, I mean, I correct me if I'm wrong, but this is probably an under researched topic about what it is, the state of cognitive health in areas which are going through some kind of conflict. And in every country there is, there are conflict zones, and what is it like? Because I think even accessing basic healthcare might become tough. I mean, we're talking about Yemen and places like that. I think a basic primary healthcare, if I understand, if I it's not very easy to access basic health, let alone very very state of the art treatment for cognitive health. And I think Dr. Austin, are you there still?
She has left. She has left.
Okay, she's left. So, Dr. Rupesh, if I could bring you back again, do you see people, because in England, you also see a lot of people who are probably, I don't know, refugees or people who've come in from other countries and who are now staying in UK. Do you see
Mhm.
any special impact on people who've undergone trauma, or who come from maybe conflict zones, or who've been mentally disturbed and maybe in a state of depression? Are they more at risk of these extreme conditions like Alzheimer's and dementia as they grow older?
Right. Okay. So that's interesting. I think you raised something very interesting, and I'm not sure if there is much literature out there about on this issue. Um, as you can understand, that these you need a lot of resources to cope and carry on with dementia, and I'm just kind of worried. Has there been any literature or any evidence been found what happens to these patients? But bearing in mind my experience with looking after patients with dementia, most of them there is a routine which helps them to cope. So whether they're living on their own or they were living in a nursing home, and whenever they come back to work,
I think we lost him.
Yeah, I think this audio is not, it's not audible. But
uh
but it's a very valid question that the prevalence, those who are living those who are living in a very had depression, anxiety because of living in a very war zone, or living in a conflict zone, or it's a
yeah,
migrant population, they have got a more prevalence. Because if you look at the risk factors for dementia, it clearly
yeah,
mentions that depressions, anxiety, these are the part of these plays a huge role
yeah.
in making it
uh,
making dementia worse. But we also know,
Reducing the risk. Yeah.
uh,
So I think Dr. Austin is back. Dr. Austin, you're back. I just saw a little notice saying that she was back. That's why.
okay,
Is
uh,
Dr. Austin, are you back? Okay. Are we lost? Have we lost Dr. Rupesh again?
I think there's some network issues going on. That's why
Really?
they're,
Okay.
yeah.
Yeah, so I mean, I think this is something which we need to. It's probably more research needs to be done, because when we talk about the need to have healthy lifestyle, that means that we are not just talking about physical health, good nutrition, etc., but also to be in a good frame of mind mentally, so that I mean, if you're in a chronic depression and a constant state of anxiety, you are, from what you're saying, then in addition to things like diabetes and hypertension, you're more likely to be prone to be prone to these extreme cases of cognitive health decline, like memory loss and um, you know Alzheimer's and dementia. Is that correct?
Right, right. These are the common things which we need to understand, because cognitive health doesn't only leads to the medical decline, it also leads
Right,
to a very huge behavioral issues also is there. That could be a depression,
right.
anxiety, a loneliness, because the
Yeah,
person cannot remember anything. Then the social life declines, and that
that's
may
true.
further leads to the decline, further leads to dementia. So the person gets fixed into this vicious circle, and he never comes out of that. So that's the issue we need to realize. Apart from these
Yeah.
medical symptoms, the behavioral issues is also more important.
And I think who all are right now with us? Is Dr. Osden and Rupesh back?
Yeah, but they will join in as soon as their network
Right.
is
No, because
fine.
I'm seeing some markers saying
Yeah,
they're
yeah.
back. That's why I'm periodically wanting to know who's on. So yeah, I mean, in India, I've actually seen people who
Mm-hmm.
have, got dementia and then eventually they kind of, they died. Um, it's very difficult, and since we don't have the kind of health system that say United Kingdom has, uh, uh, um, oh, good to
Mm-hmm.
hear from you, Dr. Alzin. Are you back?
No, I think she's muted.
Yeah, she says she's saying hello, but
No,
I don't know whether your audio is not working.
others may not be working.
Yeah, okay. So yeah, so it's also quite tough for those, like in India, for instance, mostly it's family members who are having to deal with this situation, right? I mean, we don't have that kind of health system where, somebody institutionalized care. So if it and it probably requires special skills to deal with, people who are, you know, suffering from these conditions. So I think, in terms of what should be done, I think there's also probably a need to train, or to even to sort of look after the caregivers, because from what you're saying, like memory loss, if you are a caregiver and you have to 24-hour 24/7 deal with somebody who cannot remember, it is also quite tough on the person, the
Yeah,
caregiver. It's also that person's mental health and, all the other related issues, and you don't want that person to also be more at risk of dementia. So are we, I mean, in India, for instance, what is, what is the status? I mean, do we have systems? I mean, I'm not talking about people who are extremely rich. I'm sure they can, they can access kinds of help. But say ordinary people like us, what are the systems available? I mean, if you have somebody like this in your family, or if you're at risk, what is available for you?
look, in this situation, in caregiver situation, there is something called as caregivers burnout. Uh, those
Yeah,
who deals with this these patients, frequently we see them with burnout because of
yeah,
constant care and need and attention which they require, and
yeah.
at some point of time they get burnout. And so we also need to take care of them, that they are not they're not working for at a stretch for long period of hours, because
Right,
that lead to adverse effects on their own health. So we need to take care of their health also, the caregivers health also. That's also important point which we need to make. But in India, we see mostly these cases are seen as the primary healthcare issues, and since there are some limited treatments available, mostly it depends upon the family support, and with regular health checkups we need to just take care of their vitals and other neurological parameters, uh, which needs to be stable. We need to make them socialize more. We need to help them with uh, good dietary support, and make sure that the family follows all the medicines. There's We can check over the compliance of the drugs, whether they are taking compliance of the whether they are taking medicines regularly or not, whether they are coming for
right.
regularly. So these things can be done from our physician perspectives, but there is a bigger role of the family and the caregiver in overall management of dementia.
Yeah, I mean, from what you're saying, the family physician, who is actually probably the first point of contact for any family, is can play a very, very critical role. And I think for most people, I think it's important to tell them and their family that all is not lost, right? Because you don't
Right.
want people to sink into this kind of deep despair and say, okay, now I've got this, and now life is not worth living, because then the person is just I've met a lot of elderly people who are just
Mhm.
counting the days till they die, and that kind of depression can be extremely worrying. And I'm glad, I think we've managed to actually cover. And I mean, sad that we couldn't get everybody we wanted to, but I think we've had an interesting discussion
Yeah.
today on, at least touching on some of these issues, and and Dr. Austin, if you're still there, thank you very much for also flagging this issue of, the state of cognitive health in among people who are in war zones or conflict areas and who have their special problems because they are, they don't even know whether they're alive tomorrow. I mean, if you've got bombshells and shrapnel flying around everywhere, you're probably just trying to survive, and not just you, but even your family members are just trying to survive. And maybe it's tough then in such a situation to worry about, who is suffering memory loss in the family, and it's time to take them to, health center for a checkup. And also, I think from what you're saying, it's also been very clear to me that early diagnosis is key, right? We
Right.
must, I mean, while you're saying that there's no actual cure, early diagnosis can help. And if I could just I think Dr. Rupesh, I can see you, so I think you're probably back. If all of you can just give your final thoughts on this, whoever has connectivity, the final thoughts, the last thoughts on this, on what we can do in the way as part of way ahead. So, Dr. Rupesh, are you there? Can you hear us?
Yeah. Sorry, I think I had I couldn't lost you there.
Yeah.
Uh,
So we are in the last few minutes. So, there's a kind of final thoughts because we're seeing a lot of common ground actually being covered,
yeah.
even though we are in different cities and different countries and different time zones. But what are your final thoughts on the way ahead? Because, as I said, we don't want people to think everything is lost, if they've been diagnosed with this. We want to give people a sense of hope, them, their families, their family physicians, everybody. So what are your final thoughts on how we could do it briefly?
So one of the key things is having that risk assessment of patients with dementia. So just making sure what can happen, how things will go downhill, and planning ahead is very important. As what will things are likely to get wrong, likely, and I think that thought process is so important for people already diagnosed with dementia. People who are not diagnosed, I think the healthy lifestyle, as Dr. Pratyush has mentioned a couple of times, there is no substitute. If we can manage to get a healthy lifestyle, just regular exercise, physical activity, making sure you get your blood pressure monitored, making sure your blood pressure is under control if you have, and then you can reduce the likelihood of all these things causing different other types of dementia. So I think healthy lifestyle is key. And then if you're already there, planning ahead, thinking ahead, and having a risk assessment so that making sure that you don't have any kind of issues coming out of in case you have problems with dementia.
Right. Thank you so much. And is Dr. Osden still with us?
No, she has left.
Okay, she's left. So, what do you think about it in the Indian context? I mean, before we wrap up, what are your final thoughts?
I think, as we discussed, that we need to sensitize the common public regarding the
Yeah.
common symptoms of cognitive decline, and they should take the help of physicians so that the things get diagnosed early, and they get the support from physicians, from the medical support, and also the social support. They get at the earliest. That will help them in the long run to have a better cognitive functioning for a long period of time. Thank you.
Yeah, I mean, what in this entire discussion, one of the things which leapt out at me, and I think I forget who said it, that a lot of the times what you are seeing as doctors, as family doctors, um, as actually a clinical condition, a lot of people see it as, oh, this is normal, right? I mean, I think somebody mentioned that when they start suffering, or experiencing memory loss in the early stages, or inability to think straight, or do simple things, um, they many of them and their families say that, oh, this is normal part of aging. So in a way, one can kind of starts off on the wrong foot, if I understand correctly, by normalizing a situation which actually, if you don't see it as normal, maybe it's better, because then you'll go and seek medical help, and maybe things can be arrested. So I think my final thoughts on this is that don't normalize things like memory loss, or a decline in cognitive health. I mean, even if you are 60 or 50 or 70, nothing has to be. I mean, definitive, and it's not nothing is normal. So go and seek medical care, and get yourself checked up. Like you said, even things like diabetes can actually be make you more at risk. So we must have regular medical checkups and healthy diet and exercise. And on that note, I'd like to thank all of you for joining in. And I think this has been an extremely educative experience for me. And I hope anybody who is kind of tuned in and listening to us, they also learned something, and look forward to the next Google Hangout. And thank you.
Thank you.
Thank you. Thank you.
Thanks.
Thanks.
Thank you.